I'm really excited today to talk to you guys about The Body Keeps the Score. I want a bit of reflection on what the book does for us and some thoughtful ways of thinking about the book. So let's jump right into it. So when we're thinking about this book, The Body Keeps the Score, one of the parts that jumps out to me is that the body keeps the score. It really validates that strong feeling that we have about that uncontrollability of trauma, and particularly of PTSD. It gives words to that sense of chaos, that sense of need to focus in on this thing that we call post-traumatic stress disorder and trauma reactions. And I think it does that really well. And I think it also gives word to why we've struggled to solve the problem. I think it really speaks to that frustration that many of us, if not all of us, have as we see ourselves or loved ones or people that we serve struggle following a traumatic event. I think it really puts into word and it validates that intense frustration that we can all feel and seeing that we're not doing as good of a job as we could in getting those people back to their lives and helping them resolve their problems following a traumatic event. I think it also gives us a focus and a blame for who's failing those individuals. And I think all of those things are extraordinarily validating, and those can feel really good when we experience it. And I think that's one of the things that the book draws out so well for us. I think particularly when we step back and we think about this thing that we talk about, trauma and PTSD, I think it can feel so enormous. I think we can feel so small in the shadow of this monster that we call PTSD, that many of us have seen ravage individuals who we serve or people in our own lives, and the damage it can leave in its wake. And so I think up against a boogeyman like that, I think The Body Keeps the Score speaks to that need because we can feel so small. And when we are told, listen, we have science to help with this, we start to question for ourselves, how can science solve such an enormous problem? Right? Isn't the problem bigger than just a couple p-values or an effect size? What Keeps the Score does is it weaves a myth for us to grab onto. Because I think in those times when we feel so small, that's when we look toward myth and magic and ritual and those types of things, help us to feel calmed in that way. And so we look in that outward way. And I think that's one of the things that the book does. I think that's one of the things Vanderbilt puts to word is that smallness that we can all feel. Right? And he does this by reviewing the phenomena of PTSD, the treatment of PTSD. He looks at the brains. He looks at all different aspects. He does this in a comprehensive way. I think one of the things that I keep looking toward is when we are needing so badly those answers and we feel like those answers are wanting, I think those are the times that we are the most susceptible to persuasion. My name's Dr. Aaron Brinen. I'm an assistant professor of psychiatry and behavioral sciences at Vanderbilt University Medical Center. I'm also a co-creator of recovery-oriented cognitive therapy for psychosis, a treatment that I helped co-develop with Dr. Aaron T. Beck, the father of cognitive therapy. And before I came to serving individuals with psychosis, I spent all of my career focused on serving those with post-traumatic stress disorder and who had reactions following a traumatic event. And so every paper I wrote in grad school was on PTSD, and my whole goal in life was to go and treat people in our Veterans Administration and do that work. And it's work that I continue to do today. It's work that I'm very excited about. Particularly in this journey that I went on, I started working in one of our gold standard treatments, which is called prolonged exposure therapy for PTSD. And so I'm going to talk about that a little bit later. So when I come to this and I read Vanderbilt's book, I come from a person who desperately wants to serve these individuals, but also a person who has worked tirelessly to figure out the best ways to serve these individuals. So one of the things that The Body Keeps the Score does is it's this comprehensive review of trauma reactions. When you walk away from the book, you cannot deny how insatiably curious Vanderbilt is. Throughout his whole book, anytime something grabs his attention, he searches it out, and he wants to know this better than anybody else. That is one of his superpowers. He endeavors to describe the fullest range of all kinds of information. Things like the historical basis of PTSD, the brain basis, the social basis. He really goes through all of these different pieces. He really dives into theory, and he ultimately dives a lot of his time into treatment. So like I said, when something excites van der Kolk, he goes out, he doesn't just read about it, but he'll oftentimes go and search it out, learn it, so he can put it into his own practice. And if there's no place for him to learn it, he will then study that oftentimes in order to integrate it into his work. And so while I'm going to talk about some of my concerns with The Body Keeps the Score, one of the things that I walk away with is a fellow traveler who is intensely curious. And I think that this could have been the greatest strength of the book. So as I move through the concerns that I have, I want to just sort of give a quick outline. I'm really going to start about how the book handles information, and particularly data. Secondly, I'm going to use a specific example, and I'm going to talk about how they venture to describe and think about treatment. And then finally, I really want to talk about why it all matters and what could have been done differently to make this book even more valuable. My first concern that I want to bring up is this idea of how does van der Kolk use information? When I was reading the book for the first time, I was watching the show Ozarks. And during it, the Jason Bateman character talks about how do you launder money. And so he shows his son how you launder money. And the way that you do is you take the dirty money, right, the drug money, and you put it into a dryer. And then you take the good money from a good business, you put that in the dryer, and you mix in other stuff, right? You might mix in socks and some dirt and things like that. And then out of it, you can't tell the dirty money from the clean money. And a part of what I started to realize as I was reading the book is that van der Kolk systematically engages in a process of pseudoscience idea laundering. It's like money laundering, but for pseudoscience. It's this consistent pattern where he uses a high amount of emotions to draw the reader in, to get the reader to agree with him, and then starts mixing all of the information together. And so there's some specific steps that he moves through. First, he starts with patient anecdotes. Oftentimes, or almost completely, the anecdotes engage a high amount of emotion that it elicits about the individual, right? So it's a high emotion anecdote for the patient. And then it elicits a high amount of emotion from the reader. With that high amount of emotion elicited, he then uses some flashy sounding research, right? And so that research gives whatever he's talking about an air of legitimacy in what he's talking about. Then he starts to mix in pseudoscience, beliefs, hunches, personal theories that really have no extensive founding in research. Finally, he adds a dash of historical examples here and there throughout. And then at the center of it, he becomes personally involved in the whole story. So he is the protagonist of the book. You mix all of this together, and by the time you're done with the book, you can't tell which parts of the book are science, which are pseudoscience, which are anecdotes. You just walk away with this global feeling that everything in the book has a high amount of certainty and truth to it. The first part of the process involves a high amount of emotions. Van der Kolk, throughout the book, utilizes anecdotes and case examples to drive his point. They're oftentimes highly emotionally charged examples where he uses an unnecessarily graphic description of what the individual has gone through. Now, I would say many authors, myself included, we use case examples, anecdotes, in order to drive our point forward. But there's a line between how we use those cases and how much detail we give in order to maintain an element of respect about it. And what I find throughout the book is van der Kolk uses these cases as instruments to drive his argument and really to win his argument. The cases I find are not described respectfully or with care, both for the reader and for the individual who went through it. They don't take into consideration many of the factors that lead individuals to continue engaging in the experiences or to continue to be stuck in the experiences that they're stuck in. Factors like racism, minoritization, poverty, lack of social supports. Any of those pieces are oftentimes left out of why some of the individuals may be stuck in the patterns that they're stuck in. Instead, he oftentimes describes these cases as helpless, not knowledgeable of their own experiences, and almost provides an element of shame for the way in which they make these bad decisions over and over and over again, right? Things like self-injury, elopement, substance misuse, right? And other behaviors that they engage in. And oftentimes they're described as needing a savior in order to get better. And, when I take a step back, I really think about this idea of if one of the core things we're doing when we have PTSD is trying to avoid our memories, avoid the things in our life that remind us of the memories. It's a really imprecise trick to try and avoid the memories that haunt us. Avoidance is really, it's a tricky business, and we oftentimes don't get it right. And remember that when we're avoiding these things because we're so terrified, because we've learned from our past that if you get this wrong, you're likely going to die, we don't seek out safety. We seek out feeling safe. And those are not the same thing. So a lot of times I find in the individuals that I serve that they get stuck in these patterns, not because they're stupid, not because they're bad, but oftentimes it's in the process of trying to just feel safe in your life, you make really unhelpful decisions. And none of that is captured. In the end, this level of use of emotion is a version of emotional manipulation. And I always have this sense as I listen to the anecdotes that he's almost prostitutionalizing these cases to make them work for him to drive his argument. The next part of that emotional manipulation really gets all of us on our back foot, right? When we hear these really graphic examples, it elicits a level of avoidance from us. And many people who I've talked to about this book describe feeling a level of shame that they are not well enough, that they're not recovered enough, that they're not psychologically sophisticated enough to be able to listen to the realness of these cases. And we start doubting, is there something about me? Is there something still broken inside of me that I can't hang with such realness that Vanderbilt provides us? And in those moments, it allows a lot of ideas to get slipped through. Ideas that aren't necessarily based in science. And so we're triggered and then we feel ashamed for not being able to handle it in the way a well-developed person might be able to do that. And I feel like this is a way of silencing the dissent against the pseudoscience he starts to launder. At that point, Vanderbilt starts to do this interesting dance. He starts talking about and delivering all of the studies that we've done. And the studies can range from full-size studies that are well-powered, but he'll oftentimes gloss over the fact that many of the studies that he's talking about are case studies, really small studies with 15 to 20 participants in it. Some of them are not controlled at all, but he delivers the conclusion about those studies in extremely definitive ways. This is the most successful treatment for PTSD that's ever been done. And draws these powerful conclusions. He also takes some of the studies and extends the meaning of them well past what the researcher ever would have imagined. So he'll take some brain science and then he'll generalize it for what it means overall, which is problematic because that's not the way science really works. On the flip side of it, when there's something that he doesn't buy into, when he critiques an idea, he oftentimes uses studies, but really the citations that he's choosing are biased, or the studies that he's reading, he misreads and misrepresents what the study really says. At this point, we're primed, right? Because we have a high amount of emotion. We have this idea that this is all science because we've seen this flash of science that he describes. And this is the point where we can slip in the pseudoscience. He starts talking about pseudoscience, beliefs, hunches, wishes, ideas that he came up with about what is trauma and how does trauma work. And that he mixes into the strong emotional anecdotes, literature that he cites, and then he easily slips in adjacent sentences exactly what the pseudoscience is. And he talks about it in the same vein as he's talking about these legitimate research studies that he's done. So he places them oftentimes in a historical context, right? So he dashes in a little bit of history to make the pseudoscience feel better or to hold on to old ideas that have been dispelled a long time ago. The final step of the work that he's doing is he places Vanderkolk as the savior, right? He places himself as the main protagonist for solving our problems with PTSD. But if you look throughout the book, Vanderbilt Kolk is the central character who figures it out and ultimately saves most of the people in the book. So he places himself as the only person who has kind of gone to the mountain and learned the good word. And he is the one who's oftentimes delivering it. So it places you in a really difficult bind, right? So if you don't accept the savior, then you are either not knowledgeable or you are going against it, or you're just a part of the establishment. So you don't care enough about the people, right? So you're placed in this spot if you either agree with Vanderbilt Kolk or you are part of the problem. And so in that, this finishes this idea of pseudoscience idea laundering. And at the core of it, it really smacks of emotional manipulation. And that is one of my main concerns with it. So I want to think next about the idea of treatment, because a good portion of the book is dedicated to how do we help people move forward. Again, I go back to the strength of Vanderbilt Kolk is when he is curious about a treatment, he goes out and he doesn't just read about it, but he goes out and learns it. He learns it from the source and then he practices it himself. So oftentimes he's learning about many of these different treatments like EMDR, yoga, theater, IFS, right? And he goes and he learns it from these individuals and he practices it himself so he can understand the treatment from an internal way, right? He gets it from the inside. On the flip though, if there's a treatment that he doesn't have a curiosity about or that he's turned off to, he oftentimes summarizes that research in a very negative way, mischaracterizes that research, and there's very little evidence in the book that he actually went out and ever tried those treatments, learned those treatments, outside of maybe reading a small description. Treatments like CBT, virtual reality therapy, prolonged exposure. So there's a couple problems there. One, he's talking about something that he really doesn't know anything about. And so I think that's problematic. I don't know if you agree with that. But the other problem of it is this, is he loses the ability to apply that curiosity that he has throughout the book to these treatments. So he doesn't actually know that when he describes what are the fundamental things that you need to do in order to recover from trauma and PTSD, which he describes quite eloquently, he doesn't recognize that he's actually describing prolonged exposure or cognitive processing therapy or CBT for PTSD. He's actually describing the very treatments that he goes on to mischaracterize, but he's describing the fundamental things that happen in those treatments. And so for me, it's a real lost opportunity that he could actually understand these gold standard treatments and see what are they missing? What do they still need to add? We all ask those questions. The individuals who created these treatments are still asking the question of what are we missing? What could we add to it? Why does it matter? Isn't it just good enough that people feel better? And I say yes. Every time I talk to an individual or a person in my own life, if they have gotten a treatment and that treatment helped them feel better and they're able to live their life and be there for their family or their friends or any of the things they want to pursue in their life, I absolutely am happy that somebody feels better, right? Whether they use a treatment that I'm really focused on and I use, or whether they use a treatment that I don't know much about and they say, this is what helped me get back to my life. Absolutely. I'm happy that any person is relieved of the burden of PTSD. It's the most important thing. But if we're thinking about society, the idea that isn't it just good that we feel better, it isn't good enough. Because if we take seriously the consequences of trauma and the seriousness of it, just that people get better isn't good enough. We need treatments that are effective, and we need to know which treatments are more effective, and we need to know which treatments are less effective. And there's a method for establishing which treatments are effective. And some of the treatments that I don't particularly use are currently going through that. They're doing the work to identify and help those treatments be established as effective treatments. For example, there's a treatment called interpersonal therapy, which is based off of psychodynamic therapy. They started with case studies. Then they did a pilot trial. Then they did a comparison, a non-inferiority trial. And they're slowly building up the amount of research that they have behind interpersonal therapy. I think in 10 years' time or 5 years' time, we will see that interpersonal therapy is considered one of the treatments that is really effective. But until a treatment is identified as effective, until we know that it's effective in that way, we should describe it cautiously, and we should offer it as a secondary or a tertiary treatment. Because what we know about the gold standard treatments is that they're highly effective for many of the people who engage in them. And so that's why I think it matters. So for example, when we're talking about prolonged exposure, right? What we know is prolonged exposure, it's based off of this idea that following a traumatic event, we start to avoid things. We avoid our memories of the trauma, and we avoid the things in our life that remind us of the trauma. And it also the trauma changes the way that we think. And the way that we think ultimately drives more of that avoidance. And so if we're going to avoid the memories and the things in our life, if that's maintaining the problem, what we need to do is not avoid. And a big part of this, the whole treatment, is what we call imaginal exposure, which is just revisiting the memory. And then in vivo exposure, which is approaching things that are objectively safe in our lives so that we can relearn safety as we go into it. And a huge part of the treatment is processing what we learn from it. And what happens is, as people get better, right, as we sort of play that movie in our mind over and over again, and it's less explosive when we experience it, what people start to do is they start to sort of file away in their minds the exact lessons that they've learned, the things that they need to hold on to. And we start to relearn things about our bodies, about our ability to inhabit our bodies, about anxiety. But we also start to shift thoughts about shame, guilt, disgust, right? All of those things process as we go through and as we revisit the memory. Because what happens is when we avoid something so dramatically, all learning stops. And so one of the things I thought was really interesting is when he describes the Levine and Ogden's treatment, which sounds fascinating, is it sounds like that treatment does a lot of really good things. It sounds like it does one portion of what prolonged exposure does. It pulls out one specific thing that people are avoiding, which is connection to their body. And it misses the comprehensive treatment that could help somebody fully recover and get back to the life that they want. And so I think that's sort of an important thing to recognize as we're deciding on what treatments to do. In the book, when Vanderbilt describes these treatments, particularly CBT treatments, he dramatically misdescribes and misrepresents the treatment. And I want to read the quote to you really quickly, right? He describes that during their training, most psychologists are taught cognitive behavioral therapy, which is absolutely not accurate. CBT was first developed to treat phobias such as fear of spiders, airplanes, or heights, to help patients compare their irrational fears with harmless realities. Actually, cognitive therapy was originally developed to treat depression, and behaviorism was really focused on the fears and those types of pieces. Patients are gradually desensitized from their irrational fears by bringing to mind that they are most afraid of, using their narratives and images, which he says is imaginal exposure, or they are placed in the actual but safe anxiety-provoking situations, in vivo exposure, right? And then he goes on to describe virtual reality as well. He goes, the idea behind cognitive behavioral treatment is that when patients are repeatedly exposed to stimulus without bad things actually happening, they gradually will become less upset. The bad memories will become associated with corrective information of being safe. And CBT also tries to help patients deal with their tendency to avoid, as in, I don't want to talk about it. It sounds simple, but as we have seen, reliving trauma reactivates the brain's alarm system and knocks out critical brain areas necessary for integrating the past, making it likely the patients will relive rather than resolve their trauma. So I think it's a fascinating way that Vanderbilt describes it. Unfortunately, it's 100% untrue. That's a complete mischaracterization, almost like a person who read a description on a website that doesn't like CBT. And I want to be clear, like CBT, don't like CBT. That's your prerogative. I'm not doing this because I write books about CBT. I think the important thing is be truthful when you're describing something. Prolonged exposure or flooding has been studied more thoroughly than any other PTSD treatment. Patients are asked to focus their attention on the traumatic material and not distract themselves with other thoughts or activities. And so that is a gross boiling down of what is prolonged exposure. Further, when in preparation for this, I wanted to see what studies is he quoting for things like dropout when he describes it and parts like that. He cherry picks the studies and really mischaracterizes them. So when he talks about dropout, he doesn't talk about Hembry's study, which shows that the individuals who drop out from from exposure therapy is about the same amount, is not statistically different than the group that drops out from cognitive therapy and EMDR and other narrative treatments, right? So ultimately across the board, no treatment has more dropout than others, right? That's what Henry finds. The idea that people don't drop out when they start their imaginal exposures, that they're more likely to finish treatment, even if they have a symptom exacerbation, which only happens in a small group of people. It doesn't actually change the outcome of the treatment. So there's all of these pieces that he leaves out. But he sort of quotes this idea that people who have this concept of defeat, that those people are more likely to not respond. So he mixes in the pseudoscience. So if we ignore the real studies, right, if we just push forward the idea that what we feel about CBT, I think there's sort of two logical explanations that I've always come to in the way that van der Kolk is describing this. If he really is an expert in PTSD and trauma and understands it, then on some level, he's being deceptive. He's lying about what the studies are. He's misrepresenting it. If he's not an expert and he genuinely believes this, it means that he's unintelligent, right? It means that he's an idiot who doesn't really understand these treatments and is just running his mouth. And that's fine if we're meeting at a pub, but when we're writing it in a book that sells in this way, he is pushing out unfounded ideas. And that makes all of the information in the book suspect to me. I've seen neuroscientists talk about the studies. I've seen neuroscientists who are cited saying that's not what my study says. And so ultimately, it's really important that if we're going to make sweeping claims the way he does in The Body Keeps the Score, that we're truthful and honest in what we're doing. I'll tell you that when I describe treatments that I'm not knowledgeable about or I've not done myself, whether it's a treatment that I like or whether it's a treatment that I don't like, and there are treatments that I don't like. When I describe those treatments, I'm honest about it. I talk about here are the reasons or the limitations of what I feel about this treatment. This is why I would choose this treatment over this treatment. But I also acknowledge that that treatment is an effective treatment. Here's what the studies say. This is what the research says. And so you need to make your own decision. And my problem is that van der Kolk doesn't do that when he's talking about treatments. He picks the ones that he's really personally drawn to and that he has a great affinity toward. And then the ones that he doesn't, he just decides to dash against the rocks. I think the other part of it is he doesn't recognize the fact that many people suggest things like yoga, theater, self-defense. I regularly suggest that the individuals I serve engage in these other treatments. The problem is I'm not going to say yoga will treat your PTSD and fix your PTSD because the research doesn't support that exactly. I think the problem that we run into is that when you talk about treatments in this way, you start to muddy and confuse individuals. People who are genuinely trying to figure out how to get themselves better, others better, make decisions about how to train the next generation of therapists, what should happen policy-wise at a policy level. Right? So what we put on paper has real consequences. It also starts to introduce unfounded treatments and promotes them as though they're just as good as the gold standard treatments. And again, this is not me saying, well, we should only do CBT. I think we should do the treatments that we know are effective. It also really pushes individuals to avoid the most effective treatments. It also absolves many of the individuals from continuing to do the studies that they need to do to show that their treatments are effective. If you get held up in the book and everybody says this is great, everybody runs out to start learning these treatments. They go to a workshop, they learn about it online, they search out people who do those treatments. So I want to step back before we finish up and think about what could van der Kolk have done instead. And I think there's some specific steps that could have made this book extremely valuable. One, I think de-emphasizing himself. I think one of the core sins of the book is that van der Kolk is the protagonist for solving trauma. And so forever throughout the book, it is an intellectual discussion. It is an engaging in interesting ideas. It is you versus van der Kolk. And if you're not on his side, then you're on the side of the people who don't care about patients who have experienced the worst horrors our society has to give them. And so I think that if he had de-emphasized himself, I think it would have made the book much more powerful. I think, too, he needed to speak respectfully and consider the roles of things like poverty, race, gender, other traumas that individuals experience. But speaking respectfully about the individuals that he had served, not using them as a tool to drive his own point, could have described the state of knowledge that we have in an accurate way, whether it's treatments, biology, whatever. I think describe what we know. Say, here's the things we don't know, and here's why it's important to know these things. Because I think that these ideas that we've looked at could influence other treatments, and we could make them better. And so in that way, his insatiable curiosity could have been the greatest asset to bring us all together and to think better. And I'll tell you that in my time, I have seen that some of the best people doing this work are the people who will sit across from each other and don't see treatment in the same way and have these great discussions about what works, what do you need, what do you not need. Have those intellectual discussions and let your curiosity drive you to see, can we study about these connections? Do we need to study these connections? Because in that, I think van der Kolk's natural curiosity would have been one of the greatest assets he could have given to the field. And instead, he created a book that launders pseudoscience and delivers it to the masses. In summary, The Body Keeps the Score meets a need that many of us have. It really puts to voice that we need to get serious about trauma. It also demonstrates van der Kolk's insatiable curiosity to help individuals. I think where it could have been better is to not rely on this fundamental way that he manipulates the reader and drives forward the pseudoscience and misrepresents the data. And it hadn't been the core of the book, I think this book could have really brought all of us together and had people asking questions that desperately need to be asked. Because I think if you pick this book up and you said, this is something that's important, it means that you care. It means that you care enough to help these individuals, to serve these individuals, and to help individuals get back to the life that they want and understand this better. I want to thank you again for spending some time with me. I hope this was useful and thought-provoking. If you ever have any questions, feel free to reach out, and I'd love to answer any questions people have. Be well and take care of yourselves.